Đóng cửa.
Alright, I'm bringing more chairs and
I
everybody
think
stand
that's
up.
okay. We can stand up.
Okay. Alright, you all sit in here?
Yes. I will record our conversation because we still have another brother in California, so we want to make sure everything is cleared up here.
So we don't have to drink trauma sound and
Okay.
listen to some information.
Okay. So, first of all, who's the family spokesman? Who's the spokesman for the family? Is his wife?
Let's she.
I think this guy did it. My brother-in-law.
Yeah.
But
You're the spokesman for the family?
Yeah, I can do it right now.
most of the time.
All right. So, what's your understanding of what's happening so far?
Yeah, but I know my dad been sick for a long time.
Yeah.
He had cancer. He had ammonia. He had I don't know how to call it, the blood causing the leaking blood inside. He had cancer. Have a lot of problems. That's what I know.
So yeah, he basically had lung cancer.
Yes.
All right. So his past medical history till this date has been as follows: he's had lung cancer.
Yes.
After that, he got radiation therapy.
That's correct.
Right, and that caused an ulcer.
Yeah.
All right, and his esophagus. All right.
That's correct. Yes.
He has atrial fibrillation, irregular heartbeat in the past. All right, and so he's on medications for that. All right. So that's what he was before yesterday.
Yes.
All right.
Yeah.
And yesterday, my understanding is that he sat down, had a dinner with the family, right?
Yep.
Right, and then after that, he didn't feel well. He was vomiting, some diarrhea. After that, he was found very almost unresponsive at around 11 o'clock.
Yeah, the situation, he eating around 6:30, and after that, he stayed downstairs around an hour less. He said he want to go back to the bed to sleep.
Mm-hmm.
He want to be rest, and then everybody in the family go to church. I think we left the house around 7:30.
Mm-hmm.
Then after the church, we come home around 10:30.
Mm-hmm.
And then we invite a lot of people come into the house.
Mm-hmm.
And when everybody come into the house, and then we try to go upstairs to wake him up, to ask him to go down.
Okay.
And at that time, he say he's tired, he want more rest.
Uh-huh.
And then and then they say, okay, let him rest. And then we come back downstairs, we keep continue, and then around 11:30 we try to open the gate for everybody.
Mm-hmm.
He tried to bring him down.
Mm-hmm.
At that time we recognize that he seemed to be something very strange.
Mm-hmm.
The first impression to us that we think that maybe had a low sugar.
Right.
And at that time we come over there and check the blood sugar, the reading of 104.
Okay.
And then he acting something look like the low in sugar.
Right.
And about 5 minutes later we recognize why he just don't know anything.
Mm-hmm.
He don't recognize anything.
Yeah.
He look like he try to fall and he's shaking. He feel very pale, turn green.
Mm-hmm.
We try to give him some coke,
Mm-hmm.
some sugar.
Yeah.
Sugar would mix with the water,
Right.
and then he wake up. He wake up less than 1 minute. He turned back down, like
Sure.
shaking. I mean, the face turned red.
Yeah.
This happened twice at that time, and I saw the reading about the sugar about the 104. It's not bad. That's a good number,
Mm-hmm.
but he still become like
Right.
something happened. We don't know anything.
So this is what I'm here to bridge
Yeah.
the gap. Okay.
Yes.
So I mean, just from what we can see,
Yes.
all right. Regardless, we've got a patient. He's unresponsive.
Yes.
Right, and so that's. I think I've got a good understanding of what happened at home.
Yes.
But I want you to. What's your understanding of what's happening right now?
Okay. Yeah. That got.
Well, first of all, before this, how was his quality of life? What was the expectation with the lung cancer?
I think for what I know, like after he do the radiation and chemo, they do some X-ray.
Mm-hmm.
In here, they make the schedule, but at that time they do in California, you see everything clear. You know, they say probably the cancer go away. That's what I heard. That's what I know. But what happened, I don't know. You know?
Okay.
So if you know, can you tell me more about
So
that?
so that's fine. So he had lung cancer, but it was advanced, and at this point there was no evidence of recurrence anywhere.
Yes, yes.
And what was your understanding of what would happen in the future with this lung cancer? Would it come back or?
I have no idea.
Okay, so in all likelihood, with my experience anyways, it would come back. All right, so right now he was in the clear. But in my experience, it most probably would come back at some point.
At some point.
Yeah, but right now he's in the clear. And I understand that. I've read the reports and, you know, that it looks like it was clear at this point. But now we're in a stage where, so was he nauseous and vomiting? Was he vomiting and diarrhea before all this?
No, during this time,
Yeah.
we don't see anything yet.
At home? No?
At home vomiting,
Oh, he wasn't feeling well?
no, I don't see anything.
All right, so, and what's your understanding of what's going on right now?
Oh, for right now, for
Yeah,
what we,
the situation he's in right now. Can you explain to me what you think's going on?
Can you just tell like what caused all this to happen to it
We don't
happen
know.
right now?
We
What
need to know
can you
about it.
tell like what happened to lead into this situation?
Okay, so that I can't give you a direct answer to. I would have to think that, so he entered a state, his kidneys failed, basically. He stopped urinating, okay? And then he's got some medications on which might make it, the valsartan which he takes, the Diovan.
Yeah.
So if he's not taking in as much and then the valsartan's there, it sometimes makes the problem worse. All right, so he was probably very excellently taking his valsartan like he should have. All right, but sometimes when the kidneys fail, that's not a very good drug to be around. All right,
Okay.
so the kidneys failed.
Yeah.
All right, and after the kidneys failed, the heart became dysregulated.
Okay.
All right, when the heart became dysregulated, so basically the kidney's job is to get rid of the poison, basically toxics, and it maintains a balance between acids and alkali. So it basically gets rid of acid as well.
Okay.
The kidneys and it gets rid of potassium.
Yes.
All right, so potassium in high amounts is dangerous. Acid in high amounts is dangerous. So that combination of high potassium, high acid led to his heart to dysfunction.
Was it what you call the AV?
Yeah, that's what caused the block.
Okay.
All right, so then the block happened. All right, and after that he got the wire. All right, so
Right. Was it the
yeah, so
temporary
so he basically had a temporary pacemaker. Okay, the temporary pacemaker is very uncomfortable though. And then after that he got the wire, and at the same time his breathing stopped. All right, I mean he couldn't support his oxygenation on his own,
Okay.
and that's why he needed support in the form of intubation and ventilation, artificial life support. So right now he's been, is he making urine right now?
Little bit,
Yeah, I saw that.
Very-
I saw
yeah.
he got a little bit.
very little, but,
And he's on 30 norepinephrine, is he still?
I think he's on 40.
Okay, so
Yeah,
right
he's up
now,
to 40.
he's essentially,
Plus
30
dobutamine,
so
40 or
30 is
both.
like the maximum norepinephrine, right? It's 50, right?
I mean, like, we have a max of 100, but,
Okay.
you know.
He's on, so basically he's on 2 drugs right now, which are maintaining his life. So obviously none of you take any drugs to maintain your normal blood pressure. All right, so he's on 2 agents to artificially support his blood pressure. He's on another agent. He's on, of course, so we've got 2 or 3 things which have failed on us. Number one, the fact that he was unresponsive for that time. So his mental ability during all this insult was not appropriate or suboptimal. Number one. Number 2, his breathing status is suboptimal. All right. Number 3, his heart's basically relying on this pacemaker. All right. And then number 4, his kidneys at some point, not right now, but like at some point, they might also go into failure. Okay. So overall, he's a very sick person.
Well, what you saying right now, his kidney, that part that we saw got a little urine, so it's still working a little bit. What you saying?
it might recover, it might not. I don't know.
Yeah, I know,
Right?
because this morning she was mentioning that nothing, but now I went inside, saw a little bit.
Yeah.
It looked like they do some little work in there.
It's just a little, so it's hard to know which way it's gonna go.
It could just be residual, or it could be, just, yeah, it's hard. I don't know.
Too early to tell.
Yeah, I don't know. So, we're in this situation, and obviously we're doing everything in the best of our ability, okay, to maintain his life and to help make sure he gets the best outcome. All right. Now the question comes: does everybody understand what's going on right now, or does somebody have any questions? Do you have any questions so far? Am I summarizing it okay?
Yeah, sounds
That,
good.
all right.
Thầy
All
có
right.
câu hỏi giống như tại sao bố tới trường hợp như thế này,
Hiểu.
tự thở hay là cái gì cho bác sĩ không? Trong người có gì nữa không?